What is medically assisted dying?
It really depends who you ask, because many people who talk about it, they are not always clear on their definitions. And when you ask the public what they think, they're often not clear either. Um, to say that you're assisting someone who's dying, that implies that they're actually dying. So the classic situation would be somebody who's terminally ill, maybe they've got cancer or motor neuron disease, and they're approaching the end stage of their life. And you might say they're in the dying process or the final weeks of life, and then they might be suffering with pain or shortness of breath or other symptoms that are difficult to control, and they might ask a doctor to give them medication or prescribe medication for them to take so that they can die in a more peaceful fashion than they might do otherwise. Um, but there's so many things wrapped up in that need unpacking that often don't get unpacked. So, like I say, to call it assisted dying, um, many people, particularly in Canada, for instance, who access MAID, medical aid in dying, they're not actually dying. They might be chronically ill, they might be disabled. In some places, it might be a young baby who's very disabled. It might be somebody with a mental disorder. And so you may have a degree of suffering, but they may not be dying. And so that causes a lot of confusion because often if you ask people in the public, what do you understand by assisted dying? They might think that that is the care that you get when you go into a hospice for palliative care. For someone who is dying, you are assisting them by treating their symptoms. That would be a valid way to talk, but it's not what most people understand. Or very often there are complicated ethical decisions towards the end of life. For instance, if you make a do not resuscitate decision when someone is perhaps approaching the end of their life and you think, okay, there's no point in doing cardiopulmonary resuscitation, CPR, if their heart and lungs stop because it's not going to work. That may be very appropriate just to say, we're going to make that decision that that would not be appropriate. Or you might say, you're having chemotherapy for your cancer, but it's clearly not working. So we think we
Mhm.
should stop that treatment. The treatment is futile. It's not doing you any good. Um, Many people think that that is assisted dying because then you're stopping a treatment which they may see as keeping them alive. So there's a whole range of different things, and it's incredibly important to get your definitions right, especially when they change across different countries and jurisdictions and conversations.
Currently, what's legal in the UK?
Yeah, so in the UK or in the British Isles, you've got a number of different jurisdictions. So there's England and Wales, there's Scotland, there's Jersey, there's the Isle of Man, and then there's the Republic of Ireland. And all of those different jurisdictions have got campaigns to change the law in different ways. So it's illegal to end the life of a patient. So as a doctor, you can't do something that will actively end their life. And if they
Okay.
say to you, please give me a medication so that I can end my life, you can't do that. So it's illegal to encourage or assist a suicide. It's not illegal to commit suicide. It used to be, but many people who try to take their own lives often have mental health challenges. And so if you tried to take your own life because of a mental health problem and you didn't succeed and then you ended up in hospital, what's the point in making you feel worse by then prosecuting you for something? But you still can't encourage or assist a suicide, and you can't actually do what we call euthanasia by
Hmm.
a doctor or clinician giving a drug to you to end your life. But you can do all of those other things around the end of life. You can make good decisions about is this particular uh, um, procedure or treatment that you have been having, is that actually benefiting you? Or do you want to decide yourself to stop it? Or do we decide as a clinical team that it's not benefiting you, and various things around that? So we call that withholding and withdrawing of treatment, and that can be perfectly appropriate.
So this is completely different than what's happening in Canada now.
Yes, absolutely. So, my understanding of the law in Canada is that it changed in, I think, 2016, where euthanasia first became legal, or medical aid in dying, as it's called there, medical assistance in dying, sorry. Um, and when the Canadian law first changed, well, you can have either euthanasia or assisted suicide. Euthanasia is basically when the clinician or someone else gives the medication to the person, usually through injection, to end their life. Whereas assisted suicide is where the clinician prescribes it and then provides it to the person, but then the person drinks it or takes the tablets themselves. So it's a question of who does the final act. And I understand that the vast majority in Canada are euthanasia, where the clinician will end the life of the patient. Usually that's with their express request and permission, but in some situations, particularly in countries like Belgium and Holland, sometimes it happens without the patient making a request. But in Canada, where it started in 2016, there was a clause that said that the person's death had to be reasonably foreseeable. So in many ways, that's like terminal illness. How we would say many of the proposed laws in the British Isles often put a stop on it to say you've got to be within 6 months of death from a terminal illness. It's very hard to actually guess how long someone has left and how many months they would live otherwise. But that's basically what many laws say. So that originally was there in the Canadian law, but because there was no time put it, then actually that got quite elastic. And so some people whose deaths from their condition may have taken 5 or 10 years were being seen as eligible for MAID. And therefore, in 2019, there was a court case in Quebec where 2 disabled people said, look, this isn't fair. We're not chronically or we're not terminally ill. Our deaths are not reasonably foreseeable, but we are suffering. We want to have access to MAID as well. So they were granted that access, and then that led to a change in the law across Canada, so that now your death does not have to be reasonably foreseeable. For many reasons of suffering or chronic illness, you can request that. And now there's a proposal to extend it further to purely mental conditions. I know that's been paused, but certainly that's still in the plans for Canada as well. So it really has changed very rapidly over just 6 or 7 years in Canada.
Okay, and what are the downsides if the point of this is to relieve people's suffering?
Yeah, so the downsides are largely, there's several of those. So a person's suffering may be temporary. So if someone has cancer, they have pain, they're in a lot of pain, and for instance, maybe their family physician is treating them, their GP, and they may not be able to relieve that pain. That person may think, I can't live like this, I want to have euthanasia. But if they had access to a palliative care specialist who is an expert in dealing with this kind of symptom control, they may be able to get much better pain relief, symptom control, and feel a lot better. There may be other reasons why their distress may be short-lived. It may be that actually the suffering that they're going through is largely psychological and emotional, more about the meaning of what's happening to them. It may be a spiritual cause. What will happen to me after death? There are so many different reasons for that, and somebody may not have had good psychiatric care. They may not have had good palliative care or symptom control. And so there's all of these different reasons there. And if we change a law to make it, first of all, legal, then people may access that who didn't necessarily need to have that, because like I said about in Canada, the law has expanded quite rapidly, the numbers have grown rapidly, the societal expectations have changed quite rapidly. So whereas it may have been legalized to begin with so that just a small cases would be accessible to euthanasia, then that often changes greatly. Sometimes we like to think about it, say, if you compare it with speed limits on the road, most countries have speed limits, and that's generally sensible. It keeps people safe, and yet we've all been in situations where we think, I wish there wasn't a speed limit here. We might be late for work, we might be late for the airport, we might be late for the cinema, somebody might be ill, we might be having to get them to the hospital. And so you can understand the argument of saying, I wish that I would like to have the choice not to have a speed limit. If I feel that I need to go as fast as I want to, then, I should be able to do that. And you understand that. But then when you start trying to frame a law around that to say, well, like, you can only, speed 20 miles an hour above the speed limit, you can only do it if the flight that you're trying to get to is really important. You can only do it if it's a medical emergency. All of these things get really complicated. But then what you actually do is you change society so that people just think, actually, speed limits are a bad thing. We should be able to go as fast as we can. And then what becomes my choice then becomes a duty that society has to provide for me. and then actually you change the expectations and the implications for others. You get more road traffic accidents, more deaths of innocent people. And that's quite a good illustration of what can happen, because we now see in many countries where the law has been changed, then investment in palliative care often doesn't keep pace with other countries, because people think, well, why should we spend all this time trying to control your symptoms? Let's just give you euthanasia. Why don't you opt for that? If you're an elderly person with chronic illnesses and infirmities, you may be using up the money that you'd like to give to your children and grandchildren to buy a house with, and you might be using it up in social care costs. And so
Yeah.
then the expectation comes on you. Aren't you being a bit selfish by staying alive and eating up that money? Yes, you may be suffering a bit, but actually it's hard for your family to care for you. Surely you should be asking for that. And even if people are not saying that to you, then there's definitely an expectation that comes onto people.